Hello and welcome to the Woodstock Hospital. We are a progressive community hospital delivering compassionate patient care and quality services by exceptional people. The safety of our patients is very important to us. Senior leadership endeavors to support the goals of the Infection Prevention and Control Program in ensuring a safe and healthy hospital environment for patients, visitors, and staff. Specifically, some of the goals of the Infection Control Department are supporting hand hygiene compliance throughout the organization and infection control programs that mitigate and reduce hospital-acquired infections. This video will explain in further detail some of the key initiatives of the Infection Control Department.
Hello, my name is Kim Hobbs. I'm the Manager of Infection Control, and with my Infection Prevention and Control team, we would like to welcome you to Woodstock Hospital. Throughout this video, we'll be highlighting infection control practices and explain some key strategies that will protect you during your stay at the hospital. Most of this information you're about to receive can also be found on the Woodstock Hospital website. Additional education information is available from your primary care nurse. The goal of the infection control program at Woodstock Hospital is to protect everyone from hospital-acquired infections and associated illnesses. Preventing the spread of infection is a team effort. All healthcare providers, volunteers, visitors, and patients play a key role.
Hospital-acquired infections are a serious concern in hospitals across North America and the world. Infections can be caused by bacteria or viruses that are spread by contact with the skin or through the air when people cough or sneeze. Some bacteria and viruses can live on surfaces for hours or days, and people become exposed when they touch those surfaces. Some of these bacteria, such as methicillin-resistant Staphylococcus aureus, or MRSA, have become resistant to some of the antibiotics we use. Limiting the spread of drug-resistant bacteria is another major goal of infectious disease control programs. Prescribing antibiotics cautiously as a physician is also one way of preventing bacteria from becoming resistant to antibiotics. Resistance to antibiotics limits the choice of antibiotics when the same bacteria cause infection. Woodstock General Hospital has maintained an excellent record of controlling spread of infectious disease. Great efforts are taken behind the scenes to achieve this. These efforts include staff training, enhanced room cleaning, and regular audits of our performance. Even with the best efforts, there is always a risk of spread of infections. Outbreaks do rarely occur. With your help, we can work together to protect ourselves and vulnerable patients from hospital-acquired infections.
The key strategies we will be reviewing in this video are hand hygiene, additional precautions, environmental cleaning standards, and other patient safety initiatives.
At Woodstock Hospital, we work hard to keep everyone safe. When germs are spread, they can sometimes cause infections. Every time a person touches an object or another person, germs go along for the ride. Hands are known to spread most of the germs that are within a hospital. In fact, an infection caused by someone's unclean hands can prolong a patient's stay by 10 days or longer. Hand hygiene is very important. Alcohol-based hand rub is the preferred method of hand hygiene when hands are not visibly soiled. The dispensers are located throughout the hospital. Apply 1 pump of alcohol-based hand rub and rub together until hands are dry. And when hands are visibly soiled, wash with soap and water. Soap dispensers are available at all sinks in patient rooms. Use paper towel to turn the tap off and open the door. It is important for everyone to always follow the wash in, wash out method before entering the hospital and before entering your room or patient environment. Your healthcare provider must clean their hands before they provide care. If you are unsure, please remember it is okay to ask if they have washed their hands. You can find more hand hygiene information in your admission package, and our hand hygiene compliance rates are located on the Woodstock Hospital website.
Staff at Woodstock Hospital take extra precautions when caring for patients who are known to carry germs that could potentially be passed to others. When a patient has illness or disease that can be transmitted to another person, they are placed on isolation. If you require isolation precautions, you and your visitors will be advised to follow specific instructions as identified by your healthcare team. Isolation precaution signs are posted outside patient rooms to make sure staff and volunteers and visitors are aware of any additional precautions needed to be taken upon entering the room. These signs tell the healthcare team which personal protective equipment to wear before entering your room. This also ensures the safety of staff, visitors, and other patients. Further information can be provided to you by your primary nurse, or you can ask for an infection control team member to visit you. People often carry certain types of bacteria on their skin and or in their intestines. These bacteria are usually not harmful but could be passed to another patient, making him or her sick. All patients, excluding those under 18 and those who are pregnant, will be swabbed upon admission. If specific bacteria are found upon admission or during your stay, you will be placed on isolation to ensure there is no transmission of infection to other patients and staff.
An outbreak is defined as an increase in the number of cases of a hospital-acquired infection above the number normally occurring. During an outbreak, measures are put in place to limit the spread of infection throughout the hospital in order to resolve the outbreak as soon as possible. Outbreak measures are determined based on symptoms of the illness and the identified pathogen. To decrease transmission of the illness, most outbreaks require the following: an increase in environmental cleaning throughout the unit, meaning that if you're an isolated patient, your room will be cleaned more than once per day. An increase in the use of personal protective equipment by your healthcare team in order to protect themselves and other patients. Personal protective equipment includes the use of gown, gloves, and a mask with visor. Additional lab testing may be required to identify any new cases and to determine if there's no further transmission during the outbreak. Patients that are on isolation precautions may be required to stay in the room. However, all necessary healthcare services will continue to be provided. Some outbreaks require patients to have restricted services. This means that group activities or group dining may be canceled as an additional strategy to prevent transmission, or some patients may be excluded for the safety of others. During the entire outbreak, infection control professionals are actively investigating to seek possible sources of the outbreak and identify possible gaps with the goal of preventing future outbreaks. If your unit is currently in an outbreak situation, please talk to your healthcare provider for more information or ask to speak to an infection control team member.
Hello, my name is Janice Humiston. I'm the Director of Housekeeping, Medical Device Reprocessing, and Patient Porter departments here at the Woodstock Hospital. Today, I'm going to share some information about housekeeping. Our housekeeping department is responsible for the ongoing cleaning and disinfection that is required to provide a safe environment for patients, visitors, and staff. Each housekeeping staff member receives specialized training to ensure that all hospital cleaning standards are met. The entire hospital is cleaned daily with a hospital-grade disinfectant, which effectively kills germs that are commonly found in a hospital environment. In addition to routine daily and discharge cleaning of rooms, our housekeeping team performs terminal cleans. Terminal cleans are an enhanced method of cleaning that occurs after a patient who is on isolation is discharged or transferred to another room, unit, or even facility. To accomplish timely cleaning and disinfection of the hospital environment, we use an integrated software system. This allows us to manage housekeeping requests efficiently. As soon as a patient is discharged, the housekeeping staff members are notified by text that the room is ready for cleaning. As part of infection control best practice, we complete patient room cleaning audits on a monthly basis. We do this to ensure that each patient room meets hospital cleaning standards. Our housekeeping department works collaboratively with infection control to constantly look for new ways to improve cleaning services here at the Woodstock Hospital.
Patient safety remains the highest priority for Woodstock Hospital. We strive to prevent patients from contracting healthcare-associated infections. VRE and MRSA infections in the blood, C. diff, surgical site infections, central line infections, and ventilator-associated pneumonia are monitored continuously by our infection control professionals. These rates are reported to the public on the Woodstock Hospital website under Patient Safety Indicators. These rates help guide the vision and goals of the infection control program and our organizational standards to keep you safe. If you have any concerns regarding infection control and patient safety, feel free to contact our Quality and Risk Department.
Here are some additional guidelines that family can follow to help keep the hospital a safe environment for all. Remember to follow proper cough etiquette to help prevent the spread of respiratory infections. If you or your visitors are experiencing respiratory symptoms, please wear a yellow mask to prevent the spread of illness. If any of your visitors are feeling unwell, we advise you to ask them to stay home. If you are on isolation precautions, please ask your visitors to speak to your nurse for instructions. Don't contribute to clutter. Please limit your personal items. Clutter hinders the ability of our housekeeping staff to clean effectively. Please be sure to wash your hands before touching the hospital refrigerator, and remember that all personal food and drinks are not to be stored in any hospital refrigerators.
Thank you for your time and cooperation with Woodstock Hospital's Infection Prevention and Control Program. Remember that preventing the spread of infection is a team effort. All healthcare providers, volunteers, visitors, and patients play a key role. For more information, please visit the Woodstock Hospital website or contact an infection control professional at 519-421-4211, extension 2449.